Hello and welcome everyone to our first Impact Wellbeing virtual workshop series, Getting Started. Um, I want to welcome everyone to the day's session and briefly go over the agenda. So first we will be introducing today's speakers, and then we're going to go over a little bit about the intention of the Impact Wellbeing Guide and some of the major themes. We will be reviewing action 1 and 2 with regards to content, but then also learning from some people who have actually done this work in their organizations about the impact of the work and some things to think about as you implement in your organization. We will then move to a facilitated Q&A session. So I want you to be thinking as we go along what your questions are, and you will have a chance to have those answered. And then we will close. So please note that today's session will be recorded, and we will start recording now. Well, let's get on with welcome and introductions. And I would like to start by introducing myself. My name is Stephanie Simmons. I am the Chief Medical Officer for the Dr. Lorna Breen Heroes Foundation and an emergency medicine physician by training and practice, as well as someone who cares deeply about the professional well-being of our healthcare workforce and who has dedicated my career to trying to make a difference for our healthcare workers. I am thrilled to be able to introduce our panelists as well. And if you want to learn more about the Dr. Lorna Breen Heroes Foundation, we'll be dropping the link to the foundation in the chat. As we go on to the next slide, I am thrilled to introduce our speakers today. We won't be using titles as we go forward because we want to emphasize that everyone has a role and a place in this work, and we're modeling the culture that we're trying to promote. Having said that, I do think it's important that you know who's speaking to you today, and so I will do a brief introduction by name and title. Our first two speakers will be Paul Rains, who is the System's Senior Vice President of Behavioral Health and Common Spirit Health, and John Howard, the Director of the National Institute for Occupational Safety and Health. We also will have here with us today Maureen Sintich. Maureen is the Chief Nurse Executive of Innova Health System. We have Tia Petit, and Tia is the Clinical Director of Innova Health System. We have Tara Feller, who is a clinical pharmacy manager at Froedtert Hospital, and Amy Locke, who is the Chief Wellness Officer at the Osher Center for Integrative Health. I am thrilled to be able to welcome these speakers, and I know that we will all have a lot to learn from them today. As we move on, I really want to start by welcoming you to the overall idea behind the Impact Wellbeing Guide. And so as we go on to the next slide, you'll see the first two steps in overview, and there will be a QR code here as well. And I want you to please download, get this guide on your computer if you haven't already, so that as we go through the workshop, you have it at your fingertips and you're able to access the steps as we go through. The National Institute for Occupational Safety and Health, NIOSH, developed Impact Wellbeing to campaign to improve the mental health and well-being of healthcare workers to reduce negative health outcomes, including suicide in healthcare workers. It is based on formative research findings with a primary goal of the campaign to engage hospital leaders, all of you, to revise existing or implement new evidence-informed operational policies to reduce burnout and to improve the professional well-being of all health workers. To support this goal, NIOSH partnered with the Dr. Lorna Breen Heroes Foundation to develop the Impact Wellbeing Guide, which includes 6 actions that hospital leaders can take to improve professional well-being. This guide was tested in real world in 6 Common Spirit hospitals across the US this past July through December 2023. The guide went through a lengthy revision process and incorporated feedback from many stakeholders, as well as the real world feedback from Common Spirit for greater clarity and to really provide a wide range of tools and resources that will be helpful to you. The guide is included with an overall suite of materials that is available as part of the NIOSH Impact Wellbeing campaign. And so in the chat, you will see links to the guide and also to learn more about NIOSH. Now, I know a lot of people are very aware of NIOSH in healthcare, but may not be aware of everything that NIOSH does to help support the workforce. And so this is a great chance to learn more. Next slide, please. As we go through the guide, it's important to know that the actions are designed to build on each other and to be implemented as a series of sprints. In our pilot testing, we did this over a series of 6 months. This guide helps your hospital integrate professional well-being into existing systems and operations. And so I want to briefly go over the 6 actions to talk to you about how they integrate together. The first 2 actions we will be reviewing today, and so we will be going in depth in these 2, but I want you to have a little bit of the overall guide as well. So the first step is to conduct a review of your hospital operations to know what's currently going on to help support well-being. And then to build a dedicated team to support professional well-being at your hospital, recognizing that there are many ways to do that. Step 3 is to advance access to professional well-being of your workforce by updating credentialing application questions to remove invasive or stigmatizing language. Step 4 is to communicate with your healthcare workforce, both about what your commitment is to improve professional well-being, the work that you've done so far to act on that commitment, and to establish two-way communication with your workforce to identify those areas that need improvement. Step 5 is to integrate professional well-being measures into ongoing quality improvement projects at your hospital, transforming them from triple aim to quadruple aim projects. And step 6 is to create a 12-month plan to move your professional well-being work forward. So I'd now like to welcome, as part of the overall introduction to the guide, John Howard, the director of NIOSH, and Paul Rains, system SVP of Behavioral Health at Common Spirit, to discuss the importance of leadership to improve healthcare worker burnout and how the hospital-tested Impact Wellbeing Guide can direct leaders in their journey. All right. John and Paul, it's a pleasure to have you here today. Thanks for spending some time with us.
Thank you.
My pleasure.
As the well-being work moves beyond individual resilience and towards system-level changes, why is it important for hospitals and health systems to take a more holistic approach to well-being?
Well, I'll start out by saying that, as your slide indicated, one of the major foundational issues here in the guide and in our Impact Wellbeing campaign is there's nothing wrong with building individual resilience. There's nothing wrong with that. I myself have been in many, many courses in many hospitals that I've worked in, and that adds value to all of us as healthcare workers. But a sole reliance on individual resilience is really not enough, because, as we know, all of us face structural, systematic, organizational, if you will, things that are in our life that no matter how much individual resilience you can build, can be overwhelming. And a sole reliance on individual resilience without spending time, effort in looking at some of those structural things that can be changed. Not every structural issue can be changed, but in the sense of those that can be changed within a hospital medical facility environment, then you've combined both. That's the holistic approach that we're talking about. And I think it's really pivotal to our Impact Wellbeing campaign. It's pivotal to the guide. Without that holistic approach, you're doing something else. You're not doing our guide. So that's the way I look at it. And I'm sure Paul has a special view of it, considering that he's the one that has really sort of piloted the guide in the real world.
Thank you, John. Yes, and Common Spirit was in the process of developing some system-wide well-being initiatives when this came along, and I was absolutely I mean, the kind of the serendipity of it was that how do we get this to take in our hospitals? Common Spirit is one of the largest systems in the United States with 145 hospitals in about 21 states. And one of the things that for me as the leader of behavioral health in our system is that this stays top of mind with our leaders across our system. Competing priorities in our hospitals demand that our hospital leadership teams are constantly, it's almost like scrolling through social media on TikTok. You go, it's just one thing after the other. But how do you keep this particular topic showing up? How do you keep it right in front of their face so they they certainly are aware that this is something that they have to be concerned about, because it has a lot to do with retention, with recruitment and retention of staff. Staff want to be in a place where they know that their leadership cares about their well-being. I can tell you that the word resilience kind of got a bad rap after COVID. Many of I heard this in feedback from our nursing staff, especially, is that they kind of started redefining the word resilience as, oh, we know that healthcare workers, are known for resilience, but at that point it was like, oh, okay, you're calling us heroes and you're telling us we're resilient because you wanted to get back to work. And that was really tough. It was traumatizing through COVID, the things that had happened. So if there was a silver lining to all of that, that pandemic, it was that it brought this issue to the forefront big time. And really, our hospital leaders really cannot ignore. They have to pay attention, and not that they wouldn't. I mean, they are mindful. I mean, people that work in healthcare are compassionate by nature. I believe, but how do you manage all the juggling, the priorities? How do you keep this? So this well-being guide was just a fantastic opportunity for us to, okay, here's how you do it, so.
Thank you.
Yeah, I just wanted to add, Paul, your point about the pandemic, it really got us to the point where no matter how much individual resilience you were able to muster, you got to where your system, your own body system, said, enough already, I can't go any farther.
Right.
So that's where you get to a system limit. And that's where we have to bring in those structural and organizational changes. And back to you, Steph, that's the essence of the holistic approach.
Absolutely. I always say you can take the girl out of the ER, but you can't take the ER out of the girl. So when I think about individual and system support, I think about a patient with a bleeding wound, and individual support is holding pressure on that wound. It's critical. Individuals need help when they are suffering from the unnecessary stressors of the work, when they are experiencing mental health challenges, burnout. But unless you address the source of the bleeding, the patient is going to continue to struggle, and that's where we are working to intervene in the Impact Wellbeing Guide. John, last year's Vital Signs report showed that healthcare workers who trust management are less likely to experience burnout. How can the guide help leaders in this process?
Well, I certainly am familiar with that, having been a healthcare worker, a distrusting healthcare worker, so to speak. I've been in that position too, in a very large healthcare systems where there are innumerable layers of management. Building that trust is really pivotal, as you point out. It's another foundational principle of the guide. And I think it has to start out with a respectful and considerate attitude on the part of management towards the healthcare worker workforce. Without that respect and consideration, you're never going to get off of square one. In fact, you may be at square one forever. Because to build that kind of trust, you have to communicate. And to communicate, you have to respect everybody's viewpoints, even those viewpoints, like Paul mentioned, on your social media feed from your workforce or whatever, that you would rather not look at and you would rather ignore. You have to build that into your plan. That has to be a part of your team. That has to be the first thing you look at. It has to be your problem list. All of that is very difficult in the beginning because you're sort of getting out all of that pent up issues that are not real pleasant in a lot of workforces. So I think the trust then builds from that when you can approach that respectfully, with consideration, and honestly. So that level of communication is entirely reciprocal. That's the way I look at the importance of it.
Thank you. Paul, how can leaders build that relationship with workers and reaffirm that trust?
Throughout my career, I've been on both sides, like John. I came up from the very as a clinical assistant and worked my way up and to an advanced practice psychiatric nurse position. One of the things that I've realized over my years in the administrative side is that listening to what they're saying is one thing. I can't tell you how often we take the patient, the staff satisfaction surveys, and we try to respond to these, and we take concrete action to try and resolve, and still our staff come back and for some reason they don't seem to acknowledge or notice all the work that we've tried to do to respond to their needs. This is very much the same in the same realm as that, just saying, yes, we heard you. There has to be a more concerted effort to really let them know that. I mean, for instance, for well-being and mental health, the well-being guide offers recommendations to be able to create that two-way communication between staff and leadership. It's one thing to say it is important to us. It's a totally different thing when they see it day in and day out. They hear it in their huddles, in their conversations with their leadership. They know it's a part of their culture. That it's culturally ingrained in the culture of the system, and that's what that's not an easy thing to accomplish, right? So as we develop these things, it is in very many ways just the same way that we communicate clinical information, expectations, policies, and procedures. We need to be able to communicate the expectation that we want you to be well, and that we have things in place to help with that. We can't be everything to everybody, and we can't solve everybody's problems, but we can certainly do quite a bit to convey that we do want to respond and react and be proactive in giving them the opportunity to be well and work in a healthy work environment. That's healthcare is in working 30 some odd years in behavioral health. I can tell you, healthcare environments can get sick. You can have sick cultures in healthcare environments, and anybody that's worked in those places know that. There's also the experience I've had where it feels like family. It really feels like you're working with family members that care about one another, and that's the kind of culture that I think this work engenders. So.
I wanted to add one thing, pick up on one issue you mentioned, Paul. We can't solve everybody's problem. I think we have to understand that the healthcare workplace is a highly regulated one. And there are lots of things that none of us like to do, but we have to do it. And we can't really get rid of that particular structural or organizational issue. And I think we have to be honest to say, okay, look, we have this issue. We have to do it. We all have to do it. We have to comply, so to speak, whether it's state or federal or payer or insurance or whatever. And then it still doesn't mean that, well, that's the end of it and we can't do anything. No, we can talk it out and we can figure out ways to become more efficient, more healthful, as we approach some of those things. So we can't be naive about the workplace that we're talking about. The healthcare workplace is a very unique one. It has lots of structural compliance issues, but we have to be able to put them on the table and figure out, okay, what's your reaction to that? You have a better idea of how to do it.
Agreed. John and Paul, thank you so much for your comments. As we introduce the overview of the guide, I want to pick up on a theme that both of you identified, which is the limited resources and the busy bandwidth of our hospital leaders. And I want to recognize that and also emphasize that the guide is really designed to fit into organizations using their existing resources and workflows. So as you go through these steps in the guide as participants in these workshops, please know that the very busy environment in the healthcare setting and the competing priorities are recognized, and that we've done our very best to create a resource that has utility in those environments as well, really across healthcare. So I'm going to now talk a little bit about what to expect as you investigate Action 1, reviewing your hospital's operation, and then we'll hear from some folks who have done this work. So in Action 1, the purpose of Action 1 is really to connect with colleagues across your organization to gather information about what's happening now, so that you can build on what's already right in your organization. So sometimes we start a quality improvement project or a new initiative by doing a gap analysis. What aren't we doing? And you will accomplish that in this step over some major categories. But it's also important to look for those areas of brilliance, the pockets of culture within your organization that are working well, and the projects and programs that individuals may have developed, that your organization may have developed, that are high value. So you want to make sure to start by reviewing what's underway that is of high value. To that end, we've developed the hospital review worksheet, which is available as part of the guide, and we'll show that on the next slide in just a moment. But the outcome of this review is really that you've got a better sense as a leader in your organization of what is currently going on in your organization, how the current workflows support professional well-being. So on the next slide, you'll see the worksheet itself, and each of the questions in the worksheet is designed the same way, where there is some information about the step, the question. It's asked for you to have a yes, no, and then also to have a point of contact identified who may be an expert in this particular question, and then an area for your notes, including links to internal resources, public statements, etc. And so really the purpose and the reasoning behind this resource as you go through it is to have the best sense of what's happening in your organization. Now, please remember to put questions into the Q&A as they arise as we go through these different sections. On the next screen here, you'll see the list of questions that you'll be reviewing on the worksheet. As you can see, you may need some help to complete this worksheet because these areas come from diverse components of your health system. And so I want you to look through this worksheet a little bit and really think about who you might need to help you if you had to fill out this form, because really it may be difficult for you to do that by yourself. So just look through the questions, and I want you to think, just even counting to yourself as you look through them. If I had to fill out this form right now for my organization, how many of these questions can I confidently say that I could answer without talking to anyone else in my organization? And we're going to ask you that very question in just a moment on a poll. So as you look through the questions, read them, and I want you to answer that question for you, for us. I want you to say, could I answer almost all of them? Yeah, maybe half, just a few, or none of them without asking at least one other person. All right, we'll give you a few moments to fill in that poll there. Some of these questions may surprise you. Some of these questions may not be things that you have previously thought of as belonging to a professional well-being initiative. And so as you're thinking through these questions, as you're thinking about whether you can answer them by yourself or not, if you have a question about how these reviews pertain to professional well-being, how they relate to professional well-being, please throw a question in the Q&A function, and we'll be happy to answer that at the end during our moderated Q&A. All right. I'm going to give you all just another moment to go through this poll. And I did want to just point out to you as well that both Action 1 and the hospital review worksheet are available to you in the chat via direct links that have been dropped in by Isha. Thank you for doing that. All right. Let's see our poll results. Okay, so it looks like most of you said that if you had to answer this review worksheet by yourself, you could answer just a few. There were some of you that said you could answer around half, and a handful on either end. So it's important as you think through this review worksheet to really think through who you need to enroll from your organization to help you answer these questions. This is not going to be a one-person task. We did have hospital leaders at the C-suite level as executive champions during our pilot, and they found that it was really critical to reach out to their teams. And reaching out to their teams also helped them accelerate in their work on the guide. So as we talk more about how to do this review, I'd like to invite Amy Locke and Tara Feller up to the podium here. Thank you very much, Amy and Tara, for participating in this part of the conversation.
Thanks for having us.
Absolutely. So, Amy and Tara, why do you think it's important that a hospital start its professional well-being journey with this step? Okay. How does taking stock of current operations really set leaders up for success as they begin making systems levels changes? And Amy, why don't we start with you? Oh, Amy, I'm having a little trouble hearing you right now.
I think at this point, every hospital is thinking about workforce. And so somebody at your hospital thinks it's their job to be thinking about this. And if you just come in with a preformed plan, it's often challenging because other people already have an idea about what should be the priority and how things should be moving along. I think the other piece is that if your hospital's already bought into a particular value. So for example, in my case at the University of Utah, we already were really sold on the idea of patient experience and had huge patient experience initiatives. And so seeing how that moves over into healthcare worker well-being is a much easier step than saying we're going to start this whole new thing from scratch. And then we also had a bunch of nascent programs of people about to launch things. And so to be able to collect all of those people together and think about how they would work synergistically made it much, much easier.
I love that. And really tying professional well-being into the other values and initiatives in a hospital or health system is really the most natural thing in the world, because frankly, none of those other initiatives and strategies can go forward without a healthy workforce. And so that's a critical example, and I appreciate that. Tara, what would you like to share about the importance of this strategy?
Yeah, I think this is obviously it's step one for a reason. It's really fundamental to be able to build a foundation off of what you learn is already happening within your organization. I think, Steph, you touched on kind of that gap analysis, what aren't we doing, excellence analysis, what is already going well, and how can we extrapolate from that, build on that. I think it's also kind of, as we're all healthcare workers, I think it's easy to fixate on what needs to be fixed, what isn't going well, but we can really probably get further along if we start with what's going well and what's, positively contributing to our workforce well-being and current state. And I think, Amy, as you alluded to, I think you would be surprised when you do this step, how many things are already happening within your organization. I found this in the 2 different organizations that I've worked in, that it's not that nobody is thinking about this. It's often that the efforts have been not coordinated, and that's not intentional on anyone's part, but you might have thought that nobody else was thinking about it. So you're going to start where you were, start in your department, start with your team. But I think if you start to look around, I think the guide is a great place to say, like, where should I start looking? And you'll find that there's a lot of efforts that you can either build on, partner with, extrapolate to whatever you might need to work on. So I think that's obviously why it's step one, and why we put it here, that there likely is things to be learned already happening in your organization that are positively contributing, not just things to fix or are broken or are not going well.
Thank you, Tara. I heard a saying once that healthcare has more silos than farm country, right? And so I've certainly found that to be true from time to time in my career. And this is a great way to start to break down those silos and really get a great view across the organization of what's happening. Amy, in your experience, what did reviewing your hospital operations reveal about healthcare workers' experiences and the initiatives within your hospital that could be viewed through the lens of well-being?
Yeah, that's a great question. I think along with that initial assessment of who's doing what, we did a survey of faculty. It was our first year, 2016. And some of the things that I thought would be predictors of well-being really didn't match up. So for example, I, as a primary care physician, really expected that if you were seeing a lot of patients throughput, that would correlate with burnout or lack of well-being. But that didn't hold true over the course of all physicians, because you could be seeing very complex patients in a long period of time, or super simple patients. Ophthalmology is a great example. You could be cranking through very simple visits or having really long, complicated visits, and it didn't predict at all. And so I think understanding where people are coming from and what's the initial foundation allows you to then pick and choose which initiatives you're going to lean into more deeply.
Thank you. Tara, what did you all learn in your review of current hospital operations that helped you to understand the workforce experiences?
Yeah, I think one thing, and kind of taking that step back and doing the review, is that there might be things going on in your health system or your hospital that maybe aren't called well-being initiatives, but when you start to ask people, about those things, they very much perceive them to be targeted at well-being, and they likely are, they just haven't been called that. So I think that was a surprise for me, and again, I think there are, Steph, you alluded to this too when you're talking about the guide, that you might read through that and be like, well, is that healthcare worker well-being or is it not? But I think it maybe doesn't matter if it's labeled that, if it's positively contributing to worker well-being. So that was a surprise for me when I started to think about and look at, kind of hospital operations, that there were many things that were already going on that just weren't being called, or targeted at well-being. So I thought that was a surprise. And then similar to Amy, we've done a survey at the first organization that I worked at, and we started to really think about healthcare worker well-being. I think we all make assumptions about what we're going to find when we do that. And, we had found one that, scheduling practices were really driving some of those things. And it wasn't the scheduling practices, though, that I thought it was going to be. It was like, why should I work 2 night shifts in a year when we have 20 people that really want to do that? Why can't those just 20 people do it? So I think there's often surprises. And I think, again, that's fundamental in this first step of being willing to be surprised and knowing that what you initially thought you might be working on might not be what you're going to work on based on what you find and what's already going on within the organization.
Thank you, Tara. And, as you were speaking, I was reflecting on my medical practice in the emergency department, because there is nothing I wouldn't do for the nocturnist group of doctors who work the night shifts in our group.
It's so
And,
true.
you're absolutely right that the scheduling decisions have a huge impact on physiological well-being, but honestly, also, the social well-being, because being awake at the same time as your family and friends, it has a big impact on folks. Tara, as you went through this process, what advice do you have for leaders to make sure that worker perspectives, like frontline healthcare worker perspectives, are included as part of the review process?
Yeah, I think that is fundamental to any efforts being successful, is that the individuals that you are trying to impact are included in the conversation and not at the end, right? Like, I think that's an important piece, that the team that you're leading or the people that you're leading, they shouldn't be surprised to hear that you as a leader are interested in well-being efforts, and they shouldn't be brought in at the end to say, like, and here's what I'm going to do to improve your well-being, right? So, because then you're likely missing the mark, right? If they haven't been integrated all along, we are likely not going to do the right things. I just talked about making assumptions that were not at all the right things that I thought we would be working on. So I think that's where, frontline leaders in general, that's, regular rounding with your team and making sure that they know that, healthcare worker well-being is important to you. I think modeling that, I think delivering on what you say you're going to do, involving them in that review of operations, asking them their perspectives on existing initiatives. Is it getting at the right thing? So I really think you can't involve your frontline team members soon enough, and it should not come as a surprise to them in the end, I guess, is where I would land with that.
I love that. That's going to be my quote moving forward. It shouldn't come as a surprise to anyone that there is a well-being initiative at your organization. Right. Amy, how do you ensure that healthcare workers' perspectives are included?
Well, I think it's this idea of nothing about me without me, and really implementing feedback loop systems so that workers can feel like their voice is heard, and that there's a group of people seriously considering this and implementing changes based on that results. And I've found in my groups that teams are not willing to lean into local opportunities for improvement if they don't think that the leader is working on the hard stuff. And not only hearing, but being able to articulate back, this is what we heard, and these are the things that we can actively work on, and these are the things we hear you and we can't. Like, it's beyond the capacity of the organization. And so you can't overshare that information, just as you both were saying.
I love that. We are working together shoulder to shoulder to get this job done, and we've got your back and to accomplish it. Well, Tara and Amy, thank you so much for your comments, and I know that your thoughts on this will really help as people implement Action 1 of the guide. I appreciate you. We're going to shift for a moment, and we're going to look at Action 2. As we go through this, you'll see that really on the next slide, the purpose of Action 2 is to build a team within your hospital in support of the professional well-being work. So as we move forward on the next slide, what you'll see is that Action 2 is really assembling that professional well-being team. And the key concept here is that assembling a team ensures that executive leadership can commit the time and resources to protect, improve, and sustain the professional well-being of healthcare workers, without putting the work of that on any one individual or department, but really integrating the work across an organization. That isn't to say that you may not have a leader and even an executive leader in charge of the work, but that you really need to integrate the work across the organization. I want to say those words again: to protect, improve, and sustain the professional well-being of healthcare workers. So on this action item, there will need to be choice of a professional well-being team structure, and we've presented several models. Building out that professional well-being team and really setting norms and expectations among the team on the governance structure and the goals for the team. Now, this may evolve, and we're certainly not saying that the team structure you initially choose isn't going to evolve with time as your professional well-being work evolves and matures, but it's important to have a structure to start with. So the expected outcome of this step is to have an established professional well-being team for your organization. And as part of that, we provided resources of a team roles chart and a committee charter workshop. Now, at this point, we're going to launch a poll that asks, which of this leadership team models might work best in your organization currently? And so these are the 3 leadership models that we present in step 2. The first is executive representation and co-leadership. The second is a committee co-lead by the executive team. And then the third is a committee with shared leadership. And so these are essentially different levels of executive involvement between a committee or a representative group of healthcare workers from the organization and an executive sponsor. Now, that executive sponsor may be a chief well-being officer, may be an existing C-suite leader. So I'm going to give you a second to answer this question. And some of the things we have heard from organizations is that they may not be ready to have a sole executive leading this work, or they may already have one and they need to expand out the representation from across their organization. All right, we will leave that poll up here a little bit longer as we go to the next slide and talk a little bit more about action 2. So what you'll see on action 2 is that there are different resources. There is a committee charter worksheet that really helps you think through what the goal of a professional well-being committee is, how it can operate, and what its operational goals should be. And then we also have a chart of roles within the professional well-being committee that are helpful and important to have in that committee. So what you may find as you go through the worksheet again, and the links to these resources are in the chat, is that there may be people and roles that we've recommended and that we've brought your attention to in this worksheet that go beyond or outside who you may typically think of in a professional well-being role. And I encourage you to really go through this chart and think through whether those people are currently involved in your professional well-being work, because they all have a role to play. And even an organization with a mature professional well-being component and action within their organization may still need to bring in others who haven't been represented previously. So let's see what the result of the poll was. And it looks like here we are split, folks. 33%, almost exactly down the line here, between executive representation with co-leadership, a committee co-lead by the executive team, and a committee with shared leadership. Well, that is a good indication that there may be a model out there for you that works well in your organization, and really going through this action too and learning about the different resources and different models to find one that fits your organization will be important. And let's move now to the conversation with Maureen, Tia, and Amy to talk about how their well-being teams have been formed and how they operate in their organizations. So Amy, welcome back. And Maureen and Tia, welcome to this conversation. Now, there's something special here is that Maureen and Tia work at the same organization. And so they are here to speak together about their organization. So welcome, all of you.
Thank you.
Thanks.
So Maureen and Tia, maybe you can get us started. Tell us a little more about your hospital wellbeing team model and how you got started building that team.
Sure, and thank you. We believe that culture starts at the top. And we've spent a lot of time on culture, especially since our new CEO came about 6 years ago, Dr. Stephen Jones. And so if you think about it, in the way we've embedded team member well-being, and right away, we determined with team member engagement that we wanted to call our people team members, because healthcare is a team sport. We recognize that. So that was first and foremost. We also recognize that not only is there a top-down approach to this, but there's also a bottom-up. And so you have to have the feedback and the impact to make the impact from the people who are doing the work. And so there was that recognition. And so we had some active discussion about what should that model look like in our CEO's cabinet. I'm a part of that cabinet. And, we talked about, should we have a chief wellbeing officer as an example, or should we look at our operating model that is heavily matrix, grounded in service lines, as well as the experience of our Chief People Officer, who, again, a little different title, and we believe that the words matter. And so that was the route we took. Thriving Team Members is actually a system priority area. It's a part of our strategy from the system level. And the executive owner is our Chief People Officer, with the support of the president of our behavioral health service line, who is a practicing psychiatrist, and they work together as a part of a team. But because we are heavily matrixed, we all have ownership of that, and we have aligned goals and incentives to drive the performance and excellence on this journey. And so whether it be the system level priorities that we're focused on related to the thriving team members, or at the unit level where we are embedding the tenets of healthy work environment with our frontline team members, all the pieces have to fit together.
Thank you, Maureen. Tia, can you talk a little bit about some of the ways in which that executive sponsorship and that model really sort of works throughout the hospital, so that everyone can feel that that commitment and that leadership model?
Yeah, absolutely. I think that one of the most amazing things that our leadership does is they invest time and emphasize the importance of the people leaders. So that's the managers, the directors, the charge nurses. These are all the people that they're pouring their efforts into, and trusting that those are the people modeling the behaviors. And really, they're showing us what wellness looks like too. So it really is. I love that this is a trickle down effect. And I feel the trust from our leadership, and I know that it's there. And at the end of the day, they're trusting that it's us that's modeling the behavior then to our team members that are, taking care of all of our patients. So that's where our wellness is really driven from and coming from.
Thank you. So thank you, Maureen and Tia, for sharing that. Amy, you all have a little bit different model. Tell me how that came about and the value that you see in the model that you use.
Yeah, it is interesting how every organization has their own journey for sure. I was recruited to Utah in 2015 to join one of the inaugural chief wellness officers in the country. And our initial focus was really on employee health, more like, do you get sick and does it cost the health insurance a lot of money? And very quickly after I arrived, we pivoted to include a focus on professional well-being. And in 2016, we brought together everyone who we thought was working in this space together to start to plan out what a structure would look like. And these days, I really think about this work in two buckets. One is my team. So we have a big team of people who are providing lots of services, but then there is the team of people within the organization that make up our Wellbeing Steering Committee that I chair with one of the chief of human resources. And that group brings together patient experience, academic affairs, value improvement, operational leaders, EAP, and really tries to get the organization to think about what are those projects that require cross-silo participation. It's always easy to fall back into your silo. But how do we get to a place where everyone at the organization sees it as their responsibility to lean in to professional well-being? And we tend to bucket that work in three buckets right now. One is stress injury, the other is culture and community, and then the third is how do we systematically listen to people and create opportunity to act on what we hear.
What an amazing segue, Amy, because I so appreciate your comments, and I wanted to hear more about that information gathering, right? And that ability for the entire organization to get involved. So shared governance is key to ensure that well-being work moves forward, and we've incorporated the structures of shared governance throughout the Impact Wellbeing Guide. What are some strategies that you all use to empower team collaboration and recruit team members to be bought into the work? And well, Amy, why don't you answer that first, and then we'll go back to Maureen and Tia and their team.
Sure. I think in some ways it's leaning into areas of the organization that are really interested in this work. So for example, we had nursing who had been thinking about magnet status for quite some time, but have leaned in heavily to magnet status over the last 2 years. As a part of that, there are all these requirements around shared governance and transformational leadership. And so to be able to give resources to a team and let them really run with the process has been amazing. And that's a thing that you really have to co-create. I mean, shared governance is all about co-creation. And so for us to come in and say, we should do it this way, it makes much more sense to give them the tools to be successful. I think the hardest thing for folks is getting out of their silos, as I mentioned earlier. So if you can create a framework to bring people together around a plan that encompasses multiple different levels, so for us, we have this hospitals and clinics HR org and an academic HR org. And so there's often a lot of finger pointing of, oh, it's the hospital's fault, or, oh, it's the academic's fault. But a solution that doesn't work on both sides of that house are not going to be successful. And so how do we create a space for those projects that really require buy-in? And of course, people don't even understand how the clinical operations versus education and research fit onto that breakdown.
It's so interesting. As we were doing the initial research for this guide, we were talking to groups of healthcare workers and groups of healthcare leaders, and two things became clear during that process. And one thing was that healthcare leaders and healthcare workers are often talking past each other. And the second thing was that often they want exactly the same thing, which is an effective, efficient place to live and work and care for patients. And so I appreciate your comments on that and how we can make spaces for our leadership groups, our healthcare worker groups, to come together and realize those joint goals. Tia, how does your organization recruit team members that are bought in, committed, and willing to work together across the organization?
Well, my favorite way is the volunteer. Those are my favorite kind of people, the ones that just like always raise their hand and want to come and want to be a part of things. I think in order for there to be buy-in and engagement, you have to have people that want to be there. So we know we don't always get the volunteers. It's not always that situation. But what we do, at least on my unit, is we have a lot of conversations, and a lot of times the one-on-one conversations are happening between a designated manager that you've spent sometimes years building a relationship with and you're very comfortable with. So this is a person that knows you and acts as a representation for you sometimes, and knows what your interests are. So when opportunities are presented to our leadership team, we know exactly who would be interested in that. And then we bring it back to them again and watch for their eyes to light up. And if they want to be engaged and involved in that, that's the most efficient way, I think.
I love that. So it's identifying those points of brilliance, and whether it's at the organizational or at the individual level, and making sure that everyone has a chance for their voice to be heard. Maureen, from your perspective, how does your organization do this work?
Well, I'm so glad you asked the question about shared governance. I just have to say that because I am so passionate about this. And while it was sort of born, I think, in the nursing world, I'm excited to say that it's a part of the guidebook and that it's extending well beyond. Like everything that we do, it is definitely a team sport. I'm proud of our teams and the fact that all of our hospitals are now magnet, yay. But we didn't get there in isolation. And we certainly couldn't have done it without all of our clinical team members, our system services. And so as we started to look at, again, well-being, and we have a system nursing congress, and I consider my trusted advisors about 80 direct care nurses who not only tell me what I want to hear sometimes, but they also tell me what I don't want to hear. And which is even more important, so that I can learn from them and so I can learn from their experience. But through our holistic care council, which is an interprofessional group that is nurse-led, that was really where that whole idea and concept of peer coaching came about. And so everybody coming together with their ideas, recognizing that we need to do something different, that we have a mechanism to provide an impact and support for all of our team members. And so, we are now about 5 years into this program and have over 300 peer coaches available to our team members across all disciplines, as well as system services. You don't have to be a clinician to be a support to your colleagues. And so I think that is just one example of how we heard from our frontline teams. They told us what we needed to hear as leaders. They were involved in the planning. They identified a model. They adopted the model, they trained on the model, and have disseminated the model and continue to do so today.
Parting shots, I'll start with you, Amy.
I think you really need systems thinkers, people who can get outside the box and be creative, because this is messy, messy work. And if you're going to include stress injury work, you have to have people who understand what it means to work in healthcare. Because otherwise you get bad advice like, who would do that? Why are you working like that? People really need to understand what it means to be a healthcare worker and what are the everyday experiences that we have. So thanks for this.
Thank you, Amy. Could not agree more. Maureen.
I guess my parting shot would be if you provide an opportunity for your team members to be their best selves, that they will deliver on excellence every single time.
Awesome. Thank you, Maureen. Tia.
I would say really spend time engaging the team. Teams will surprise you, and what wellness looks like to them might be different than what wellness looks like to you. So really hearing from the team members themselves on what they need and what they want is going to be really impactful.
Excellent. So making sure you're not aiming at a target that's actually in the other room, right? And that all your work is going to the right direction. Thank you for that, Tia and Maureen and Amy. I appreciate all your comments on step 2 and how you've implemented that in your organizations. Looking at our time, our time is just about up. And so I'm going to go round robin style for everyone's last thoughts that they'd like to share with our audience today. And then we'll just have a few housekeeping things at the end. Amy, what are your last thoughts for our audience today?
Celebrate the wins. This is hard and you're not going to transform healthcare overnight. And so being able to recognize when good things happen and not just focusing on the negative is really important as part of this work.
Thank you, Amy. And I felt that one in my soul. Tara, the final thoughts.
I would build on that and say, don't recreate the wheel, leverage the things that are working well and continue to build from that.
Thank you, Tara. Tia.
I think knowing where your resources are, knowing who can help you make connections. We heard a lot about data. Know who your data scientists are and how they can help you procure things. That's would be really helpful.
Thank you, Tia. And a good reminder to speak more about our information resources on our future webinars. Paul, final thought.
I agree with Tara, not reinventing, there's so many different organizations. We talk about silos. Even in this work, you've got the American Hospital Association, you've got other associations doing a lot of this work, kind of landing on something and taking, not having to go back and recreate the wheel. I think that's very important. You've done a lot of great work for us and we appreciate it.
Thank you. Thank you, Paul. And not only the Impact Wellbeing Guide, but I want to point out that the Impact Wellbeing Guide is really built on amazing resources from across the professional organizations that represent healthcare workers, from across hospital organizations and the Office of the Surgeon General as well, and that there is a whole team pulling behind all of you on this. Maureen, final thoughts?
Trust your people. They have amazing ideas. They'll bring them forward, and trust is a big part of this.
Thank you. And I love the call out that trust is 2 ways, just as frontline workers need to trust their leaders and their leaders need to be trustworthy. Front leaders also need to trust their people and their wisdom. Thank you for that. And last but certainly not least, John, some parting thoughts for us today.
Oh, thanks, Steph. We were given money from the Congress, from the people's representatives to launch Impact Wellbeing. And NIOSH does all of its work through partnership. And I'm just overwhelmed by all of my fellow panelists who are partners of ours now. And all of you who are listening, all of you who attended this webinar, and I hope you'll come to webinar 2 and 3, you're now our partners. Thank you.